All right. Thank you so much, panelists. I'm going to pull up our quick Arizona oral health update. This will be pretty short, but also I know we've been going and going. Feel free to take a bathroom break or anything you need during this time or whenever. But we'll go ahead and just get started with our AZOHC update then. Let me share my screen. Okay, Tami, take it away.
I will. I have to go back to that integration and all that medical dental integration because that's deep to my heart. So I just wanted to say thank you, the panelists that were on that, and the hygienists especially. We know that we are prevention specialists and we need to be in there starting things right. So who we are as coalition is we're we're a nonprofit organization, advocacy organization that brings together stakeholders from across the state to enable collaboration action for policy change. The coalition membership is composed of independent regional coalitions, community organizations, individual members that represent a variety of professions, communities, and backgrounds. Next. You can move the next one. I don't know if you wanted me to read it because it's right there, but our vision is everyone enjoys the benefits of good oral health as an integral part of overall health. This one is very deep in my heart. And when we talk about how the vision of the coalition is, I don't know when the mouth got separated from the body, but to me, the vision is to bring it back. If we could just every once in a while just get in with our legislators and just talk to people and just tell them how important it is for people with diabetes, how much money we would save, or low term or like babies that are born underweight and so forth. So this is really dear to my heart. So I want everybody to know that the vision is what our organization's about. And our
I think you're breaking up, Tami. Can we turn your video off? Is everybody frozen or is it just Tami?
Just Tami.
Just
okay.
Tami.
Okay, I'll go ahead and that slide was almost over, so I'll just go ahead and go forward. Tami will come back when she's got her internet back. So again, our mission statement to be the catalyst for oral health policy and systems change that benefits all Arizonans, especially underserved communities, by uniting health advocates, community, state leadership, and like-minded organizations. I think based on the keynote that we heard and from the advocacy panel, medical dental integration panel, this is, really what we've been talking about throughout this whole conference. So it's really in line with the mission of the Arizona Oral Health Coalition. Okay, so like many of you in your roles in personal and professional lives, we're talking about sort of surveying the landscape, thinking about where we've been and where we're going. We know that these past couple of years have posed new challenges for the Arizona Oral Health Coalition as well. New challenges, but also exciting opportunities. So despite us being a mostly volunteer coalition, with seeing workloads at day jobs increase and the mental capacity decrease as a result of COVID-19, AZOHC members and leadership team have worked so hard to grow the coalition's reach, inspiring more folks from medical and public health professionals, students, and lawmakers, all of those people to really care about oral health. AZOHC has worked to form new and exciting partnerships over the past couple of years that serve to elevate oral health as a factor in overall wellness and well-being, a lot of what we've heard in the panels already. And we've really had the opportunity over the past couple of years as well to connect with advocates across the country by attending national events like the Open Conference, which is the Oral Health Progress and Equity Network, as well as the National Oral Health Conference. So we're always trying to learn from our national partners, see what other states are doing when it comes to increasing access to care, and really just benchmark and share that way. So we are always looking for more partners who are passionate about a healthy and thriving Arizona. I think Montrese said it. I think Dr. Shaw and folks on the advocacy panel said it. We're louder together. We are all louder together. And so by hosting things like this conference, we're really hoping to facilitate more of a conversation and bring all of our voices to the forefront to really make a change. So one of the projects that we are really proud of this year is the launch of our Adult Dental Benefit Campaign and Story Collection Project. I'm sure if you all are signed up for the AZOHC emails, you've probably seen a million action alerts and things about this from me. If you're new here, this will be new to you, but something we're really proud of. So Arizona Oral Health Coalition worked with Children's Action Alliance to collect stories from folks all across Arizona on how a lack of oral health coverage has impacted their lives. These stories became a crucial part of our Oral Health is Essential campaign. We'll continue to advocate for comprehensive dental coverage for adults who participate in access. We talked a lot about that in the advocacy panel. So this is our campaign, which really helped to sort of propel Dr. Shaw's bill and looking forward as well to a comprehensive dental bill. And in part of that was sharing stories from Arizonans all across the state to highlight just how important having access to oral health care is. So I'm going to go ahead and share with you one of those stories. Just make sure that the sound will come through. Make sure. So we'll just hear from one of those stories.
A heart doctor. They said oral.
Let's start that over.
I didn't know this, but a lot of them, even my primary care and my heart doctor, they said oral health is very important. It contributes to some of the health that you had, regular health. And I don't think the government looks at it like that. They need to realize that preventive medicine is just as important as when it's an emergency. As a matter of fact, it stops things from becoming an emergency. You know what I mean? And that will save the government a lot more money if they think about it, because when you're paying for the emergency situation, if you can avoid them, it's a lot more cheaper to avoid the emergency than it. I had an emergency, so I went and took care of the emergency, and that was an extraction. And then I went for the actual appointment like a couple of months later, and the lady said, your insurance, dental insurance, is only for emergency only. I literally thought she was lying to me because I couldn't believe this is the only thing, and the only thing that's an emergency is getting a tooth pulled. Other than that, what is emergency, So they basically ain't helping you, but for an extraction, to be honest, which is very, very limited. This is America. We should be able to get care for our dental health without feeling put down, without feeling, like we're begging or something like that. We need to have some dignity about it.
Okay. So that was just one of the many stories that we have featured in that campaign. Switch the slide here. So as I mentioned, these stories did help to inform our larger oral health campaign, which is called Oral Health is Essential. And again, dedicated to seeing an adult dental benefit in Medicaid. As Dr. Shaw and those on the advocacy panel mentioned, we were not successful at the legislature this year. But I think we all made a promise to one another on that panel that we will keep trying. And so that is what we're going to do. We built a strong foundation and elevated the conversation around oral health among lawmakers. And so we encourage all of you participating today to visit our landing page. That's the URL there at the bottom, and we'll also send that out. But you can visit our landing page here to view and share more of those stories and any work that you might be doing. You can sign on to our position statement. You can share a story of your own. And if you want to be part of a strategy and conversations and looking ahead to how are we going to get this through the legislature next year, and even looking through to administrative advocacy as well, make sure to reach out through our contact form and sign up for our advocacy committee. That's where we do a lot of that work. You can also make sure to check out our calendar of events on the website as well, join public meetings, and stay up to date on our activities. All right, Tami, I'll let you close us out.
All right. Sorry about everybody. I don't know what happened to my computer. Just crashed or something. So looking forward for the Arizona Oral Health Coalition, we will be embracing a more member-centric model. And that means more opportunities for you to connect with us and reach out and continue to move the needle towards access to oral health care for all Arizonans. Look out for our member activities, CE opportunities, and of course, our advocacy opportunities. If you're not a member of the coalition and interested in joining or getting involved, join at Arizona Oral Health or AZOHC.org. Make sure to sign up for our newsletter to stay up to date on the coalition activities and oral health news from around the state and nationally. I appreciate everybody on this call right now. So we'll move forward to the next thing.